So, hi all, and welcome to this webinar on creating an inclusive social protection system so people with disabilities can engage in waged employment. And this is the 6th webinar in the series of the Foreign and Commonwealth Development Office funded Innovation to Inclusion program. So I'm the moderator for today, Mark Carew. I'm a senior researcher at Leonard Cheshire, and thank you very much to our friends at European Disability Forum for hosting. I'm very, very excited today to be joined by 3 excellent speakers, Dr. Morgan Banks, Dr. Daniel Mont, and Amin Laji, who I'll properly introduce ahead of each talk. But first, I have some housekeeping rules for you all, which are being shown on the screen right now. So the first thing to say is that there's sign language interpretation and captioning available, and the captioning link is within the chat box. So what is being shown on the screen is the sign language interpreter and the presentation slides. And all attendees to this webinar are muted, but you can still ask questions, and please do. So for technical issues, please use the chat box, and for content questions, please use the question box. So there'll be a Q&A at the end after each of our speakers' presentations, but please do send your questions along. You can send them as our presenters are talking, and we'll aim to answer everything at the end. And if we don't manage that, then we'll follow up by email. And there's going to be an accessible recording of this webinar and a transcript that will be available later on the website, and we'll share the link to that then. And I want to say thank you in advance to our excellent interpreters and captioner, and a reminder to our speakers to please go a fairly steady pace, and so not to rush, so our interpreters and captioner can keep up. So the captioning link is also shown on the screen right now, and don't forget to tweet. And you can also see the Twitter handles of everybody and the organizations on the screen right now. So our first speaker today is Dr. Morgan Banks. Dr. Morgan Banks is an assistant professor with the International Centre for Evidence in Disability at the London School of Hygiene and Tropical Medicine, and her primary research focus is on disability, poverty, and social protection in low and middle income countries. So I'll hand over to Dr. Morgan Banks.
It seems, sorry, this is Marion, one of the organizers. It seems that Morgan is offline, so I'm just going to try to sort that out.
She said she cannot unmute herself.
Okay, we're gonna try again.
She's here.
There we go, and we're gonna make it a presenter. Here we go, I think that's sorted. Sorry about that.
Okay, is this showing the PowerPoint?
No, it's showing the all your desktop.
Oh, okay, a second. Sorry. Okay, is there the PowerPoint now?
Yeah, yes, you just needed to, yeah, here we go, it's perfect.
Perfect. Well, thank you very much, Mark, for the introduction, and sorry for the technical difficulties there. So for my session, I'm going to be talking about disability-related costs and how these are managed by people with disabilities and their families, including the role of social protection in managing these costs. So just for a bit of background, for those of you that maybe are less familiar with disability-related costs. So people with disabilities face both direct and indirect costs. So indirect costs we might be more familiar with. So these are reduced opportunities for earning. And these are faced by both people with disabilities, but also other members of their household. So there's a lot of research that shows that people with disabilities are more likely to be either unemployed or underemployed compared to people without disabilities, and that they earn lower salaries when they do work. Similarly, other household members might forego work opportunities or reduce their working hours in order to provide assistance for people with disabilities in their household. There's also increasing attention paid to direct costs of disability, also referred to as extra costs. So this is additional spending that people with disabilities require for goods and services that are necessary for participation. So this might include rehabilitation, assistive devices, medications for certain health conditions or epilepsy, as well as personal assistance and additional transportation when existing options are inaccessible. So to illustrate what we mean by extra costs, I'll go through a scenario. So let's say we have two individuals. We'll say Mary and John. Mary does not have a disability. John does have a disability. Both of them have the same income. They both earn, let's say, $100 per month. And with that income, both of them have some essential basic items that they have to cover. So food, housing, water, clothes, and let's say those come to about $70 per month. However, John also has additional costs that he must meet. These might be for disability-specific health care, for additional transportation, for assistive products, and all of these goods and services cost $25 per month, let's say. That means that John now has only $5 left over, while Mary has $30 left over in disposable income that they can spend on, say, education, on social life, on entertainment. So we could see here that because of these extra costs, John's standard of living is actually lower than Mary's for the same income that they earn. It might also be as well that instead of $25 for extra costs, perhaps these extra costs cost $200. Since John's income is only $100 and he has other costs as well, he can only afford a small number of the disability-related costs that he requires, which can then impact on participation. So to illustrate the extent to which these costs can impact poverty amongst people with disabilities and their households. So when we look at indirect costs, these are mostly captured in traditional poverty measures, such as through poverty lines. So people with disabilities and other household members have a lower income. This will be reflected in the proportion that live below the poverty line. The direct costs, the extra costs, on the other hand, are rarely captured in determinations of poverty, but the effect of these costs on financial well-being could be quite substantial. So here we have an example from a study that was done in Cambodia. This found that using a standard poverty line, about 18% of households with members with disabilities were living below the national poverty line. However, these households were also spending about 19% of their income on these disability-related extra costs. When these costs were factored in, we then saw that 37% of households without disabilities would be considered to be living in poverty. So that's quite a big jump. And what's important to note is that these were just what the costs that households were spending on. There were other costs that were likely unmet, and these unmet costs can affect the individual's functioning and their broader participation. So there are many different ways that we could measure these direct costs. So in the previous example, we talked about the standard of living approach. So I won't get into the details of how this is calculated, but it's basically a modeling approach that provides us an estimate of the total amount that people with disabilities and their households are spending on these direct costs. So it gives a rough total amount, but it doesn't say what people are spending on, and it doesn't take into account costs that are not met. There's also another approach called the goods and services approach, which involves asking people with disabilities and their households about their spending patterns on different disability-related goods and services. So here we can see the items that people are spending on, but again, we're not able to see different costs that they have not been able to meet for one reason or another. And then finally, there's the goods and services required approach. So this does capture what people, the spending needs of people, both costs that people are able to meet, but also those costs that they're unable to meet for one reason or another. I'm now going to talk a little bit about a piece of research that we did in Kenya and Bangladesh as part of the i2i project. So this was a qualitative piece of research. So we weren't trying to quantify the costs, but we were looking at the types of costs that people with disabilities faced, as well as how they were able to meet these costs. So the types of costs that we found were fairly standard. So if we looked at the indirect costs, we saw that both people with disabilities and their households had more limited employment opportunities and lower salaries when they did work. They also had, there was also costs in terms of time. So people with disabilities often had late starts to school or gaps in their school, and so they were entering the workforce later, for example, which cut down on their earning years. Travel was also one, so taking longer to get to work, which cut down the working hours. There were also fairly standard direct costs. So there was the typical medical costs for assistive devices, rehabilitation. There was the need for accommodations for participating in work and school. And there was also for transportation. So in the absence of available, accessible transportation, people with disabilities sometimes had to spend on more expensive private options. And there was also reports of having to pay more for the same journey. For example, asking a bus driver to wait so that they could board the bus and having to pay extra for that. Some people also paid for personal assistance. However, this was more often an indirect cost covered by family members. And there were many different challenges in meeting these costs. So lack of income is the one that we tend to think of most often. And this was very much true that this was a significant challenge in meeting all these different costs. However, there were other factors as well. So one of them was the lack of decision-making power within the household. So the allocation of resources and deciding whether that goes towards a disability-related good and service or something else that the household required. And then a further challenge was limited information about what types of goods and services the individual needed. So there was quite a low awareness of things such as rehabilitation, assistive devices, inclusive education options. There was also a limited awareness of different programs and strategies that could be used to minimize costs. So for example, a lack of knowledge of social protection programs. There was also a poor availability and quality of the goods and services that were required. So people may have had the money, they may have wanted to spend on it, but if it was unavailable in their area, then they couldn't purchase it. And finally, there were many costs that were needing public investment rather than private spending. So things like inclusive education or accessible infrastructure would be beyond an individual's means and also beyond their power to implement. So here is a quote from one of our participants. And in this quote, it's a man with a hearing impairment by a sign language interpreter in Kenya. And what this person is saying in this quote is that he was at home, not going to school for 2 years because when he became deaf, because his parents didn't know about sign language and that there were schooling options for children with hearing impairments. So it was only after these 2 years that a friend of his mother told her about, in this case, it was a special school where they did provide instruction in sign language. So we could see here some of the challenges in meeting those costs. So there's clearly a lack of information. So in this case, the parents were not aware of inclusive education options or alternative education options. There's also an element of availability as well. So perhaps if there was an inclusive school that was in that child's neighborhood, they would have been able to access that option earlier. So here we can see it's more than just income that affects an individual's ability to meet extra costs. And here we could see also that the direct costs lead to indirect costs. So this child was at home for 2 years. So that impacted both the length of schooling that he was able to complete, and it also impacted when he was able to enter the workforce. So he's joining a minimum of 2 years later, and that's 2 years that could be earning years. This research also found that there were many impacts of the costs. So as I was saying before, some small direct costs could often lead to much higher future direct and indirect costs. So not being able to pay for an assistive device in childhood could impact education and future earnings. Both direct and indirect costs also cause financial strain for families, and particularly unmet costs cause reduced health, functioning, and well-being for the person with a disability. And ultimately, this led to decreased participation in education, work, and social life. I then wanted to end with just a discussion of social protection. So social protection was a dominant strategy used particularly in Kenya for managing costs. And it's an important strategy that can be improved upon. So the programs that were available in both settings to offset direct and indirect costs. So looking first at indirect costs. So there were several opportunities for improving earning opportunities. This included a quota in both settings, although I'll note in Bangladesh, the quota was suspended at the time of data collection, as well as subsidized training and job matching. So this is trying to improve employment opportunities for people with disabilities. There were also programs focused on direct costs of disabilities. So these, and in turn, they could also impact indirect costs. These included in Kenya, there was a free and subsidized assistive device program. There were cash transfers in both settings that were disability targeted. Kenya had an income tax exemption, so people with disabilities didn't have to pay the 30% income tax. And Kenya also had health insurance. So while these programs were important, they did have some limitations. So for example, the cash transfer in both settings was tied to the person being both disabled but also poor. And so the amount was really too small to be able to cover both the disability related costs and also allow the household to meet their basic needs. And other eligibility criteria was too restrictive. So in Kenya, the person had to require full caregiving support in order to be considered eligible for this program. So you're really only capturing a small portion of people with disabilities who are eligible for these programs. Turning to health insurance, which was available in Kenya, there were limited coverage of disability-related items. So there was some coverage of rehabilitation, but not the full range of services people required. Similarly, there was an assisted device provision scheme in Kenya. The challenges here is that it was a complex application process and there was quite long and unpredictable wait times. So we had some respondents talking about how they needed a walking cane for their daily life, and so waiting 3 weeks to get a cane or a replacement cane really was not an option for them. The income tax exemption was popular among formal sector workers in Kenya. It was limited to the formal sector, and the challenge was that the exemption dropped off after the individual hit a salary of the equivalent of $1,450 US. So individuals that were getting close to that threshold had to make a difficult decision between going slightly beyond that threshold, but then losing that quite a large benefit of not having to pay 30% income taxes. There was also some other programs such as the quota and training schemes. So these were rarely used in practice because they had kind of quite complex application procedures, and there was also quite poor awareness of both the programs themselves and how they work. So I think that this is probably a good transition point for turning over to Dan, who's going to talk much more depth about social protection. But you can see here there are some positives of social protection, but there are also some limitations that need to be worked on if these programs are going to more fully address disability-related costs.
Thank you very much, Morgan, for a fascinating presentation. And certainly, I have a burning question to ask you at the end, as I'm sure many of us in the audience do. But yes, I'd like to turn the floor over now to Dr. Daniel Mon, who is co-president at the Center for Inclusive Policy and formerly senior economist at the World Bank. So his work is primarily in the area of disability measurement and indicator development, as well as in the education and social protection policies in low and middle income countries. So please take it away, Dan.
Hello, everyone. Nice to be with you. So my presentation follows, directly from Morgan's, where we're trying to think about, once we understand these extra costs and we can start measuring these extra costs, how do we incorporate that into the design of social protection policies? So the first slide, please. So first, let's take a step back and think about what is social protection? What are the goals of social protection? And they really are two main goals. One is income support, to try to provide a minimum level of income, a level of income that society has determined that people should not live below. And then the second is access to services, covering things like healthcare expenditures and other social services. And we deliver this through cash and through in-kind goods, and also in-kind services. So next slide. So keep going. Yeah, there you go. So the CRPD refers to social protection. It says that the state parties have the responsibility to provide adequate standard of living on the equal basis of others, which kind of corresponds to that first part of social protection, but also to ensure that persons with disabilities have equal access without discrimination to all social protection schemes and programs. And I like to think of social protection programs not so much as social protection programs, but social participation programs. Right? The goal of these programs is to make sure that all people, if we take a human rights approach, that all people have the right to fully participate in society, and that the society has a responsibility to make sure that people receive that level of support that enables them the full enjoyment of their rights. Next slide. So as Morgan explained very well, because of extra costs, households that have a member with a disability, even if they have the same level of income as another household, because of those disability-related costs, they're living at a lower standard of living. And they have to make the decision about where they're going to skimp. Are they going to spend less on the basic necessities that all people have, or are they going to spend less on what the people with disabilities need to fully participate? And the goal of social protection programs, hopefully, is to eliminate this disparity. Next slide. So let's think about three different households. A household, households A. The blue bars represent the income of the people, the households without people with disabilities, and the orange, people with disabilities. So in household A, we see that both households have the same level of income that's below the means test threshold for some social protection program. Okay, so both of these people would qualify for benefits. But what if household, but household A has extra cost of living? So if it was measured by the standard of living approach, okay, somebody who is actually above the means test at the top of that bar is actually living at the same standard of living as the person, as the blue A person, right? So if the means test wasn't adjusted for the extra cost of living, somebody living in a household with a person with a disability who is above the means test threshold in terms of the actual income that's coming to the house is actually living at the same standard of living as a non-disabled household who would receive the benefit. Okay, so without adjusting the eligibility line for the extra costs of living with a disability, people who are in effect living in poverty, even though they're not technically, officially living in poverty, wouldn't be getting the benefits that they should be getting. And let's look over to person, the households B, and here both households are above the means test. Okay, but if the benefits do not equal the standard of living extra costs of disability, then that household would still not achieve the standard of living that's above the prescribed eligibility line. But the most important one to look at is households C. Here we have a household C who's way above the means test threshold. Okay, is not anywhere close to getting social protection benefits. And let's say that the household with a person with a disability has the same level of income all the way up there. But if the goods and services required for that person to fully participate in society is large, and it can be quite large, as I'll show you soon, then they could be actually living way below the poverty line in effect, okay? So the first response that people usually have when they see these kinds of charts is that, okay, what we need to do is adjust the means test threshold, okay, so that we factor in the extra cost of disability. But and then we just need to give people the extra cost, the standard of living extra cost. And as we'll see in a minute, that's not going to be adequate. The next slide, please. Because once we start getting into what people actually spend money on, we see that the extra costs of disability vary dramatically. Okay. Here we see they vary dramatically by the type of disability. And even within the type of disability, by the degree of disability. So people with mental health high support needs have very large extra costs. And that red dotted line, okay, is the weekly minimum wage. So, and this is the data from New Zealand. So in New Zealand, people with mental health high needs have several times the weekly minimum wage they have to spend because of extra costs. But people with mental health moderate needs are not very high. Okay, intellectual needs, you can see high needs, very high. Hearing, people with high needs, they're spending about twice the weekly minimum wage on extra costs, but people with moderate hearing needs, a little more than half the weekly minimum wage. So if we try to design a program based on average cost and say, oh, the average extra cost that people with disabilities face is whatever, $50 a month, $100 a month. If we give that to everybody, we might be greatly under providing benefits for some people, and actually over providing for others. And if you see the breakdown, you see where the huge costs come in. The huge costs come in support, right? If we take out support needs, personal assistance and things like that, then we see the variance between the amount of cost that different people need is much smaller, which leads to the conclusion that maybe social protection benefits need to be divided between support services, which are granted, and then cash or other concessions to provide for the other costs, which are more standard across different people with different types of disabilities. Next slide. And even within, and just to emphasize the fact that even within a particular type of disability, those costs can vary dramatically. This is data from South Africa, and it shows the minimum and the maximum that the people in the study were spending on extra costs. The blue line are the minimum, orange the maximum. You can see, like, for deaf persons, the minimum amount was almost nothing, but the maximum amount was huge. Persons with deaf blindness, the same thing. And why is that? Sometimes it's because of the extra cost of participation. If I'm deaf blind and I'm staying at home and I never leave my house, my extra costs are going to be very small. If I want to go out into the world and get an education and work and go to religious ceremonies, then I need an interpreter guide. My costs become very high. So the extra costs that are measured through something like the standard of living or the goods and services measured, remember, they're only measuring what is being spent, not what is needed. And when we see when people want to participate and their needs go way up, their expenses go way up. And the point of social protection is to allow people to fully participate. Next slide. Okay. So what can be expected from inclusive social protection systems? There's several things. I'll go through this quickly because I'm probably running out of time. Basic income security, covering healthcare costs, and then disability-related costs, and facilitating economic empowerment and education. Next slide. Okay. And so the structure of these benefits, we need to be able to break them down across the life cycle, also by the types of benefits. So for all registered persons with disabilities, right, regardless of income level, there should be affordable health care. There could be concessions to offset basic costs. For example, discounts on transportation is a common one. And economic empowerment programs to improve their ability to earn a living. And that should cover for all people with disabilities. And then we move to the blue in the middle column, for persons with significant support needs. Okay, and there we want to have disability cash allowances to cover those basic costs, because there's idiosyncratic costs. I mean, we can't itemize all the various ways that people have to spend more for various reasons in different situations. But we need to supplement that with access to support services. And this is where the really large costs come in, okay? And then notice that the first two columns have nothing to do with income level, right? They're just trying to cover those extra costs that all people with disabilities face. But then in the last column, for people with disabilities with no or low income, they can be covered by the same kind of income security programs that all people could be covered by: unemployment benefits, poverty assistance, and maybe a disability pension as well for people who are, some countries, people who can't work. There's a disability pension. Next slide. Okay. And these pathways for providing this income security, well, within household benefits, we have poverty assistance for poor households. That's all countries tend to have that. Households with reduced work capacity, and we can include in that money for benefits for households with a person with a disability, okay, to try to cover those extra household costs. But we really also need to think about those individual benefit levels, and that tends to differ across countries. In some countries, there's a disability pension that's associated with the inability to work. It can be poverty targeted or means tested, as well as in South Africa. We really want to break this, though. We don't want to say that disability benefits only go to those people who can't work, because the purpose of social protection is to enable people to work. All right. We don't want people with disabilities to have to make the choice between work and benefits. That's not CRPD compliant. So in some countries, they've done this. They have a universal disability benefit. It doesn't matter if you're able to work. It doesn't matter if you're working. In countries like Mauritius, Fiji, Thailand, people with disability get that universal benefit. The purpose of it is to cover those extra costs. Actually, the amounts are very small, so they don't really cover the extra costs, but the structure of it, the intent of the program is to do that. And then finally, the third level of individual benefits are economic empowerment programs, microgrants, vocational training. These are things that are not specific to people with disabilities, but these programs need to be inclusive. They need to be accessible, so that there have been times in the past where people with disabilities have not been eligible for micro grants, or vocational training programs are not accessible, and so they're closed to people with disabilities. So we need to have a collection of these things. Next slide, please. Okay. So so just to reiterate, the coverage of the extra costs at the household level, countries take an approach of a disability top-ups. In Zambia, for example, if there's a person with a disability in the household, the level of social protection benefits, I believe it's doubled, but it's increased. But we also need to focus on those personal level, the universal disability benefits that's compatible with work, the support services, caregiver allowance, third person support allowance to cover those extra costs, and then also things like support services, rehabilitation programs, provision of assisted devices, and concessions like the tax exemption that Morgan was talking about in Kenya. Next slide. Okay, so again, in coverage of healthcare costs, countries take different approaches. Some have partial subsidies of health insurance, some completely subsidize the premium, some only target people who are living in poverty. So there's two conditions: you have to have a disability and you have to live in poverty. And some countries cover everybody with a disability, automatically gets covered by the health insurance. But one thing which tends to be true in most countries is there's not full coverage of rehabilitation and assisted devices. And these are the things, as we've just seen, are the major costs of disability. So the thing which actually matters the most in the economic lives of people with disabilities is the thing which tends to be the least covered, and that's rehabilitation, support services, and assisted devices. Next slide. Okay, and for access to support services, again, there's different approaches. Caregiver grants that are given to the caregiver, not the person with the disability, and that there's problems with that. Third person support allowances, personal assistance, and guide interpreter schemes, sign language interpretation. There's various ways, various types of support services, and various ways that countries that do provide them try to provide them. Next slide. I think that's it. So thank you very much. That was quick, but I'm happy to hear your comments and your questions.
Thank you very much, Dan, for another fascinating presentation. And just to say that the Centre for Inclusive Policy have done a background paper for the i2i project on disability-related extra costs in social protection that I believe is being shared around the chat. And for our next speaker, I'd like to introduce Amin Laji, who's our research operations manager at Leonard Cheshire, and who Amin has more than 20 years of experience in research and development, and has been working in the academia and health sector for a very long time, particularly designing multi-center research studies, randomized control trials. And Amin has numerous academic publications, particularly in the Lancet and British Medical Journal. And Amin currently leads our research team at Leonard Cheshire, and we're very grateful to have him. So I will now hand over to Amin for his presentation on inclusive social protection.
Thank you, Mark. Thank you, ETF, for having me on this webinar. I think that Dan and Morgan has made my work much easier, because there are so many things that they have covered, and I will specifically talk about the work of i2i research that we are carrying out through the social protection program that we are running. So as Morgan and Dan rightly said, that if you look at the schemes of social protection in countries, especially low middle income and middle income countries, there are 4 specific types of schemes. The first scheme is basically about disability specific schemes, and these schemes are basically there in order to for those people who are identify themselves as having a disability. Then there are schemes which are disability relevant schemes, schemes which are not offered to everyone, but they are offered to people who are veterans or who are in the old age. So these 2 schemes are basically very specific. But the next 2 schemes, which are the targeted mainstream schemes and mainstream schemes, these are the schemes that are basically of very much interest to us. So if you look at the targeted mainstream schemes, they basically are geared towards those people who have an incapacity to work, but disability is also one of the criterias of eligibility to be participated or part of this scheme. And then there are mainstream schemes where the eligibility criteria is not linked to any type of disabilities, but people with disabilities are eligible on the same grounds as all the others. So what is for interest to us are these 2 schemes, the targeted mainstream schemes and the mainstream schemes. And if you go into the detail of these schemes are basically with the objective of alleviation of poverty. And disability is not being taken as the primary issue to be addressed. So disability comes as second. So as Morgan and Dan said, that people with disabilities who are part of the household, they don't get the benefit from these schemes because these schemes does not take into consideration the extra cost of disability that people with disabilities have. So based on that, Leonard Cheshire has a very strong social protection model. And this model goes beyond the elevation of poverty. So Leonard Cheshire, as you all know, that's a pan-disability organization, and its social protection scheme, social protection programs goes beyond poverty alleviation. And what we are looking at is to make sure that people with disabilities and children with disabilities, they can access all the other services which are part of the government schemes and the private schemes as such. So that we have taken a very comprehensive approach. And this approach is based on 3 basic pillars. The first is beyond poverty alleviation. As Dan rightly said, that social protection schemes are not only social protection schemes, they should be social participation schemes. So we are not taking poverty or schemes in order to reduce poverty by benefit, but we want to make sure that these schemes make people with disabilities a part of the larger societies. They give them the autonomy, the choice to make sure that they have greater participation in their employment. And in all these 3 focuses, what is important is to understand that we are taking a very twin track approach on supporting the mainstream schemes, but making sure that these mainstream schemes are also disability inclusive. The second area that we are looking at is the diversity of needs, because gender, age, location, types of disabilities, these are very important issues when we are looking at designing and developing social protection schemes. And as Morgan and Dan rightly said, that without the understanding of extra cost, one cannot ascertain that whether these social protection schemes can be successful or not. But whenever we talk about social protection scheme, we take that as social protection scheme, but there are other things or other factors attached to it. And there are 2 important factors. One is the role of evidence and research, and the other is the role of disaggregated data. I think that these are the 2 main pillars on which all these 3 focuses are based on. So based on that, what we have defined is the current problems in evidence and research. And one of the problems that we are seeing when we're designing the i2i project is the difficulty in operationalization of and the translation of the right-based approach within the scope of work. And what we mean by that is implementation of disabilities social protection schemes is less and less related to the eligibility criteria and financing of the schemes, but they are more and more uh, to be looked at in the terms of right-based approach, and seeing that how these schemes can make sure that people with disabilities are part of the society at large. Then there is a more evidence is required to see that how these social protection schemes are working in low and middle income countries, and what are the indicators that we can develop in order to measure these schemes. One of the major focuses of the evidence and research that we are carrying out is to look at the social protection schemes from a gender lens, because people with disabilities, especially women with disabilities, have different needs and they have different responsibilities. So how these schemes can address those needs is basically what we are looking at. So based on that, we have developed a hypothesis. The hypothesis is that there is a significant gap in understanding on how disability leads to extra cost of living and poverty in low and middle income countries, including Bangladesh and Kenya, where the i2i program is working, and which has direct relevance to informing the design of inclusive social protection program for both the countries. The major focus here is a significant gap, and when we talk about significant gap, we are talking about there are many gaps when we try to understand the social protection schemes in the light of extra cost. For example, one of the gaps is we don't have a definition of disability, and because of that, there is a lack of data that can be compared. Then there is also a lack of data on the different types of cost and how these costs can be seen in the light of severity of disability, duration of disability, gender, age, and educational level. And the most important of all is that we do not have a method by which we can quantify the cost of disability. So based on that, the i2i project, when it started with the research questions. And the research question that we asked was, what works to create an inclusive social protection system enabling people with disabilities to participate in the salaried employment? And I think that what Dan and Morgan pointed out is social protection is basically social participation. We want people with disabilities to participate in the society as equal partners with all the others who are people without disabilities. And how we are going to achieve this? There are three basic steps that we have defined. The first is we have defined a practical and solid methodology for defining that what are the costs that are faced by individuals and how we can ensure that they have equal access and retention. And based on identifying the cost, we are then identifying what are the cost-effective strategies which we can develop both in cash and in services by which we can address these costs. And the last and the most important of all is not only we are developing evidence, not only we are starting a pilot project, but we want these learnings to be shared with countries like Bangladesh and Kenya and other low middle income countries to make sure that how these learnings can be incorporated in their own social protection programs. And one of the major aspects of all this is basically the consultation with the DPOs, because DPOs are the ones who are leading the process. They need to understand, because in our research, what we have found is that DPOs are still they haven't had an understanding of how social protection works, and not only social protection, but the extra cost of disability, which is very much a strong part of social protection. Before I finish it up, one of the things that i2i is developing on the basis of the research that we are conducting is to develop an access to work scheme, and this is a pilot scheme for 1,000 people that we are developing in Bangladesh and Kenya, and this 500 people in Bangladesh and 500 people in Kenya. And the basic objective of this scheme is to present a sort of a model, a sustainable model of how social protection scheme can be developed into a social participation scheme by looking at the range of interventions like personal assistance, cost of transport, stipends, assisted devices, how social protection schemes can take into account all these costs. And then when all these costs are taken into account, how can we make sure that the government and those who are running these social protection scheme take that into consideration in order to develop a new scheme for people in Bangladesh and Kenya. So what we have achieved so far, so we have done a strong policy analysis of the social protection schemes, and we are at the present looking at the cost of disability, and for that we are doing a research of looking at the extra cost of disability in Bangladesh and Kenya. And not only that, but we are also looking at the availability of data which is related to disaggregated data, as well as the data on social protection and on the schemes that we have in different countries. And not only that, we are involving DPOs into the whole process in order for them to understand that how we can make sure that people with disabilities and their extra cost are focused or are part of the focus in the whole social protection scheme. Thank you.
Thank you very much, Amin. Now we've run over time slightly for questions, so we did have a number of questions come in, and they will all be answered via email if we don't get to them. But in view of the lack of time, I'd like to ask one question to the speakers collectively, and if you could please keep your answers brief. So there was a question that came in. How does the additional cost of disability differ in relation to gender, and are there outstanding challenges in terms of learning more about women with disability as compared to men with disability? So if I could go to Morgan first.
Well, one thing that comes to mind is in the ability to meet some of those extra costs for women with disabilities. So one of the challenges to meeting costs was around the decision-making power within the household. So women are generally globally more likely to have a less dominant role in particularly financial decision-making. So that then impacts the ability to spend on extra costs.
Thank you, Morgan. And Dan, next.
Oh, I thought you were asking me another question. No, I think that's the main one. I mean, of course, women's have healthcare and reproductive needs that men don't have. So there's another avenue within that gender might play a difference. But I think Morgan's point was probably the most important.
Okay, thanks, Dan. And Amin, any comment to that question?
No, I would second what Morgan and Dan said, but especially from a health perspective and from my own health background, if you look at specific diseases and if these diseases are looked at from a disability lens, then especially women with disabilities have far more costs. And one of the studies that we conducted a while back, especially after let's say one of the studies on late effects of cancer that we conducted, and the costs that that women with disabilities have in comparison to men with disabilities when it comes to, let's say, after effects of cancer is 20 times more. So health costs and all the other costs which for women are sometimes much more. So that must be taken into consideration.
Thanks, Amin. So as I mentioned, due to the lack of time, we'll answer the other questions via email. What remains is for me to thank our excellent speakers, Morgan, Dan, Amin. Thank you so much for the fascinating presentations, and thank you also to our friends at European Disability Forum for hosting, and especially to our interpreters, Lissa, Bo, Christine, and our captioner, Tracy. Thank you very much, and thank you all for listening. This concludes the webinar.
Thanks.